Let's talk about something we've probably all dealt with, or at least dreaded, the medical bill. You know the one. It shows up in your mailbox and it's confusing, frustrating, and sometimes just shockingly high. Well, today we're going to pull back the curtain on those bills you never saw coming. We're going to look at both a broken system and at some outright criminal scams. And this really gets to the heart of it, doesn't it? It's this super common question that just leaves you feeling completely powerless. You did your homework, you picked an in-network hospital to keep costs down, and then bam, a bill arrives that your insurance barely touched, leaving you on the hook for a massive amount. How does that even happen?
And the impact of these bills can be absolutely devastating. Just to put it in perspective, a recent survey found that 4 out of every 10 Americans would have a hard time covering an unexpected $400 expense. Think about that. So many people are living right on a financial knife's edge. And as we're about to see, these surprise bills are often way, way bigger than that.
Okay, so to really understand this, we need to separate two totally different problems. First up, we're going to investigate the one that isn't actually a crime. It's a deep, deep flaw in how our healthcare system is built. This is what's known as the classic surprise bill.
So, it all boils down to this thing called balance billing. It's a fancy term for a pretty rough situation. Basically, your insurance company pays an out-of-network doctor what it thinks is a fair price for a service. But then, that doctor can turn around and legally bill you for the rest of it, for the balance. And trust me, that balance can be huge.
Right? And this is the part that feels like a trap. How can this possibly happen when you were so careful to go to an in-network hospital? You're there, in a hospital bed, assuming everyone who treats you is covered by your plan. But that's exactly where this sneaky little loophole gets you.
Here's the kicker. The hospital building and the doctors working inside it, they're often two completely separate businesses. So the hospital itself might have a contract with your insurance company, but the private physician group that staffs the emergency room or the anesthesiology department, they might not. They're basically independent contractors, and you, the patient, are just caught right in the middle of their business dealings.
And this almost always happens with these specific kinds of specialists, the ones you have zero say in choosing. You don't get to pick your anesthesiologist before a surgery or interview the radiologist who's going to read your MRI. They're just assigned to you, which means you have absolutely no choice in the matter.
And get this, the problem has been getting worse, a lot worse. A major study from 2019 looked at millions of insurance claims, and what it found was pretty staggering. The average potential surprise bill for a hospital stay more than doubled in just 6 years. It jumped from about $800 to over $2,000. That's a huge increase.
So that's the surprise bill. It's a result of how the system is designed. It's legal, but let's be honest, it feels completely unfair. Now, it's really important to draw a hard line between that and something else entirely, outright criminal fraud. This stuff isn't a flaw in the system. It's designed from the very beginning to steal money.
Okay, so let's shift gears and look at how these criminal scams actually work. Unlike surprise billing, this isn't about finding loopholes. This is about deliberate, calculated deception, and it often targets the most vulnerable people in our society. A huge, and I mean huge, target for this kind of fraud is something called durable medical equipment, or DME. We're talking about things your doctor prescribes for you to use at home for a long time, like walkers or knee braces. Scammers see this as a goldmine, and they see Medicare as the bank. This scam has gotten so common that the Federal Trade Commission has this incredibly blunt advice. Scammers will run TV ads, they'll cold call seniors, they'll send junk mail, all promising free medical gear. And the only thing they need to make the whole scheme work is your Medicare number. The way it works is simple, but it's brutally effective. They trick seniors into giving up their Medicare information, and then they use it to bill the government for thousands of dollars worth of equipment that is either totally unnecessary or just incredibly cheap junk. The patient might get a box of flimsy plastic braces in the mail, but Medicare gets a bill for a small fortune. And the scale of this, it is just mind-boggling. In one single recent bust, the Department of Justice charged hundreds of people in schemes that involved over $14.6 billion in fake billing to federal healthcare programs. Let me say that again, that's billion with a B. So at this point, you might be thinking, okay, that's terrible for those people, but why does a surprise bill sent to my neighbor or some Medicare scam actually affect me? Well, the answer is pretty simple. These costs, they don't just vanish. They create a ripple effect that touches all of us.
With surprise bills, the effect is kind of hidden.
Just the threat of being able to send patients those massive out-of-network bills gives these specialist groups incredible power at the negotiating table. They can walk up to insurance companies and demand crazy high in-network rates because they know the alternative is even more painful for the insurer's customers. And guess where those high rates end up? Yep, in all of our insurance premiums. And you can see this leverage crystal clear in the data. It's wild. Research shows that specialists that patients actually choose, like an orthopedic surgeon for a knee replacement, get paid on average about 164% of the Medicare rate. But anesthesiologists, the ones you don't choose, they can negotiate rates more than double that, a jaw-dropping 367% of what Medicare pays. And all that leverage really adds up. Some researchers estimate that if we could remove this out-of-network threat and bring those specialist rates more in line with everybody else, it could save the entire system about $40 billion every single year. That's a massive cost that's being passed on to all of us. Now, with fraud, the impact is way more direct. Every year, billions of our taxpayer dollars, money that's supposed to be paying for the health and well-being of our seniors, is just stolen. Plain and simple. It weakens the whole Medicare system and drains resources that are desperately needed for actual legitimate care.
So, what have we really looked at here? Well, we've seen two very different problems, right? One is a flaw, the other is a crime. But they both lead to the exact same unsettling result: a medical bill you never saw coming for an amount of money you probably can't afford.
So what this really means is that in one case, you, the patient, are basically collateral damage in a high-stakes business negotiation between these massive companies. And in the other case, you're the direct target of criminals who see the sheer complexity of our healthcare system not as a problem, but as the perfect camouflage for their crimes.
And all of this really leaves us with one final, very challenging question. When you have a system with cracks so big that both legal loopholes and criminal schemes can flourish, whose job is it to protect the patient? Is it the hospital, the insurance company, the government? Or does that massive burden, in the end, just fall on us?